In our first community conversation, we're joined by Dr. Thomas Shin, a minimally invasive and bariatric surgeon with UVA Health. He's sitting down with Aaron.
Dr. Shin, we appreciate you coming in today.
Absolutely. Thanks for having me.
You're very welcome. So today we're talking about, I hope I don't butcher this pronunciation, but gastroparesis.
That's right.
Okay. So what exactly is that?
Yeah. So gastroparesis is a disorder of the stomach. Simply put, the stomach is made up of multiple muscle fibers, and sometimes these muscle fibers don't contract and move correctly, and they're not coordinated. And that can cause delayed gastric emptying, a lot of nausea, some vomiting. It's an underdiagnosed disease, but very detrimental to quality of life.
And what are the common symptoms?
Yeah, so nausea and vomiting are really the principal ones. It can cause a lot of reflux, bloating. The constellation of symptoms are quite wide and diverse, which is why diagnosis of it is a bit of a tricky endeavor.
And what does treatment typically look like?
Yeah, so at UVA we have multiple different modalities of treatment, including medications as well as endoscopic procedures, and then all the way at the other end of the spectrum are multiple surgeries. What we're most excited about is the introduction of what's called the enterotherapy device, which is a gastric stimulator. So it provides gentle electric impulses to the stomach to kind of help its coordination and movement. So it's like a midpoint between medical therapy as well as full-blown surgery.
And what type of treatments are available at UVA Health?
Yeah, so all of those above. So medications, endoscopic procedures, and the Entera device, as well as the multiple different kinds of surgeries that we do. We have a multidisciplinary foregut team where patients who have these types of disorders and symptoms get evaluated by medical doctors and surgeons like myself, and we come up with an interdisciplinary plan of action for each patient.
That's wonderful. And is gastroparesis, is this something that affects a certain age group, or can anyone get this?
Yeah, so the answer to that question is pretty difficult to ascertain. What we do know is that it's more common than what we actually think. It is associated with a lot of different disorders like diabetes, and diabetes, as we all know, is very prevalent in our population. The problem with diagnosing gastroparesis is it comes on with nausea and vomiting, which, for the most part, a lot of people think, it's probably a stomach flu or, something benign. And so it's often missed. It is more prevalent in women than men, about fourfold difference. And some studies have even said that, for patients with diabetes, up to 1 in 3 patients with diabetes actually have gastroparesis. It's just underdiagnosed.
Oh, wow. So I guess that's one reason why awareness is so important, to get the word out there, so that people know if they are struggling with it, they know what it is, as opposed to just thinking it's the stomach flu or something else.
Yeah, 100%, which is why we're proud partners with all the gastroparesis medical societies. We're trying to promote Gastroparesis Awareness Month this month, as well as providing the public with knowledge and information about how to treat gastroparesis and diagnose it and get the help that patients need.
Absolutely. Well, thank you so much, Dr. Shin, for coming in. It was great having you here.
Yeah, absolutely. Thanks for having me.
You're very welcome. Steve?